Hello, I'm Dr. Crawford. Today I'm going to talk about the sacroiliac joint. And you know, that doesn't sound real exciting, but I'm here to tell you that it really is. That the sacroiliac joints in the human body are absolutely amazing, and their effects are profound. Now, the sacroiliac joint, I'm going to use my acupuncture model here, but the sacroiliac joint is on the back side of the body, in the pelvis, right in this area right here, okay? Here's where the joints are. They are the major weight-bearing joints of the body. Very important. What happens is, when they become subluxated or unstable, what we get is a cascade of events that create some dysfunction in our structure. Okay? So, the sacroiliac joint has been called the most subluxated or dysfunctioning joint, if you will, in the body for a number of reasons. Like I said, it's the major weight-bearing joint that we have. We can get a tip-off that somebody has a problem with that joint. When you watch them try to get up from a seated position, they'll have to brace themselves and push themselves up. Usually they lean real forward and they push themselves up in order to get up. In a grocery store, you'll see people leaning over the cart, putting all their weight on the cart to take the weight off the sacroiliac joint. Another little hint that they may have a problem there. So what happens? Well, when the sacroiliac joint becomes unstable, if you will, when somebody stands or gets in a weight-bearing position, the spine compensates for that instability. It'll compensate for that instability. So what it'll do, because the center of gravity is now altered, what it'll do is make shifts in order to try to keep one centered, to try to keep the eyes level, and to keep you functioning. The low back, the lower lumbars usually will shift, will rotate. Many times there will be an elevation of the first rib up towards the top. The scalene muscles on the side of the neck will tighten up on the side of dysfunction. The temporalis muscle will tighten up as well. Temporalis being above the ear here. And that's also a TMJ, temporomandibular joint muscle. So when that muscle tightens up, it can affect the TMJ, causing jaw problems. And on and on and on. As you can see, it's of paramount importance. What happens? Why do we run into trouble so much with the sacroiliac joint? Well, a couple of theories. One of them is that within that joint is only ligaments. And ligaments are not meant to be stretched in a prolonged fashion and kept that way. When that happens, the ligaments actually become lax, they become weak. So one of the worst things is the student syndrome, where somebody is sitting in a desk, leaning forward all day long, stretching that joint. Not a good thing. Now we have people leaning over a computer, doing exactly the same thing day and night. Not good. If we're going to be doing that, we should at least be doing exercises to counterbalance it. But a good idea not to be leaning forward and stretching that joint and holding it there. A couple other things. Of course, injury can stretch the joint. Stress itself can affect it. A couple of reasons why. Number one, stress, when the adrenal glands are affected, they are depleted from stress. There's an intimate relationship between the adrenals and ligaments. So the ligaments actually will become weak when the adrenal glands are depleted. That's also why people injure themselves more when they're under stress. Ligaments hold joints together, hold bones together. They don't do it. So people go out and do things, do some work, do some exercise, When they're under stress, they hurt themselves. That's why. Not a good thing. The sartorius muscle is also connected to the adrenal glands. We know this from the work of applied kinesiology. The sartorius muscle attaches up by the anterior part of the pelvis and on the medial side of the knee, but it's a pelvic stabilizer. So when that muscle is affected, that in turn affects the sacroiliac joints. Okay. Now another thing that happens when the sacroiliac joint becomes lax is the body will tighten up the inguinal ligament in the groin line. In the front of the body, the inguinal ligament runs in the groin line. Okay, the body will tighten up that ligament in order to stabilize the pelvis. It's weak in the back, it'll tighten up in the front. Now, if it stays that way, it can affect the nerves going down the front of the leg. That in turn can affect the major weight-bearing muscles of the quadriceps. So here's what happens. We have the SI joint, the sacroiliac joint, is affected. And what I neglected to say earlier is when it's affected, the muscles that attach to that joint, there's only ligaments within it, but muscles that attach to the joint are the gluteus maximus muscles, which are the muscles of the hind end, the big muscles of the hind end. Now these muscles are designed to lift hundreds of pounds. They're very big, strong muscles. But when they weaken, that's one of the reasons why people will lean forward when they go to get up. Those muscles have weakened. So now all of a sudden those muscles are not operating. It becomes much more difficult to bend over and lift things. The body has to use smaller intrinsic muscles to do the work they're not designed to do. And that's one of the reasons why people injure their backs more when they have sacroiliac dysfunction. So now we have weakness of the gluteus maximus muscles in the hind end. We have the inguinal ligament tightening up in the front, which can then affect the big quadricep muscles in the front of the legs. And if those muscles become weakened, we have the biggest anti-gravity muscles that we have on the back side, on the front side, and both of them are shut off. So what's keeping us up? What's doing the work? Again, we're having to rely on other muscles, other parts of the body to take over that function, and they're not designed to do it. And that's why somebody will bend over and pick up something as light as a pencil, and bam, their back will go out. It's obviously not because the pencil was too heavy. It's because of the dysfunction of the mechanics that could have been set up from sacroiliac dysfunction to begin with. The types of exercises that would be needed when this is going on would be extension exercises, anything that contracts the gluteus maximus muscles. I like if someone is lying face down, bend the knee, bend the leg, and you can come straight up towards the ceiling with the leg. That would contract those muscles. Sometimes people can't even do that. Standing, you can start off with just contraction. When you stand, contract, relax, but start kicking in those muscles. Another thing I want to mention here as far as causes. A lot of times people will come in and they will complain that they have a shoulder problem, a knee problem, an ankle problem, and it's all on the same side of the body. Generally what these people have is a nervous system imbalance. They've got one side of the body that is basically needs some power. It's basically shut off. So they've got a nervous system imbalance. They need treatment to actually enhance nerve activity on that side. And invariably they'll have a weak sacroiliac joint on that side as well. So that's why in my line of work I have a natural medicine practice, but I don't neglect the structural work because it's extremely important. If the body's gonna heal, we need to get the nervous system in balance. So in those cases, we want to find out, okay, where do we want to implement our therapy, and our whole goal is to prime the pump of that weak side, so to speak. So I'll elaborate more on that in a future DVD. But thanks for your attention. I hope you got something out of this video. Please visit my website and like us on Facebook.